Welcome to Edison Open House Global Healthcare 2021. In this session, we're going to be showcasing the work of CureMetrix, a company using AI to develop next-generation medical image analysis. With me is its CEO, Navid Alipour. Navid, welcome.
Thank you, Vivienne. Pleasure to join you.
So let's start by trying to set out the problems of a radiologist faced with interpreting a ton of mammograms.
Absolutely, that's a huge problem for radiologists, and it really does start with that work list, which is like an email inbox for them. So the radiologist has no idea which cases are the most urgent and to get to immediately. A great example is one of the top radiologists here in the U.S. at UCLA, Dr. Greg Eccles, shared with us when he sits down at 6 p.m. to look at mammograms for the next 4 hours. He doesn't want to get that suspicious case at 9:58 p.m. He wants to look at that first thing. And that is critical, to have him be fresh and to look at the urgent cases first, instead of this first in, first out basis that has them spending a lot of time looking at mammograms that are not as urgent.
And radiologists themselves are a very precious resource, aren't they? I mean, I know in the US you have quite a number of radiologists, but that's not the same across the world.
100%. Of course, in the US and in the Western world, we have a lot of doctors, a lot of radiologists. There's still a shortage, but it's a massive, massive problem in the rest of the world. In Mexico, for example, in the entire country of 150 million plus people, they have under 200 radiologists with a mammography expertise. So breast cancer is, in fact, a massive problem, and we do have Mexican VC investors for that very reason, in fact.
And often, I think I'm right in saying this, that radiologists have to double check an image, by which I mean, they check it and they have to go over to their colleague and say, and now will you check this? And so you need an awful lot of radiologists in order to interpret a kind of a borderline mammogram.
This is very much the case. And, you have obviously radiologists with a mammography expertise. Some are more senior, some are more junior. So this is an issue when it comes to detecting false positives and false negatives. Unfortunately, there are many, many cases where something seems suspicious and the patient has to go through the unfortunate procedure of a biopsy. And in fact, it wasn't necessary. They didn't have anything. So this is very much so the case that they want a second pair of eyes, really. And mammography in the U.S. Is one of the most litigious areas of medical malpractice as well. So that's a huge problem. And in fact, many radiology centers and big imaging centers, they don't even hire radiologists unless they commit to reading mammograms 1 day a week, because they shy away from it because of that litigious nature.
So I'm now going to toot my trumpet and say sort of a big trumpet noise and saying, enter stage left CureMetrix. So you come into this picture. How did you see this problem and how did you try and address it?
Would love to talk about that. So we came at this with an artificial intelligence focus first. And then we said, what is the problem that AI can solve? And something we always tout is AI is not meant to replace the radiologist, but the radiologist that does use AI will replace the radiologists that are not. It's frankly another arrow in their quiver in the fight against cancer and in helping deliver better patient outcomes. We all know detecting cancer earlier vastly increases the odds of survival, especially with breast cancer. Not to mention that it costs significantly less to treat stage 1 or stage 2 breast cancer. In the US, it's about $25,000, whereas stage 3 and 4 is upwards of $150,000 a year. So it's a win across the board to detect the cancer earlier. We have two core solutions that help with this. One is our CM Triage, which is the first FDA-cleared AI-based triage solution for mammography here in the US. And I'm happy to say that we just got our Anvisa clearance in Brazil, which is the FDA equivalent there. And so that's CM triage does exactly what we were talking about earlier, that the Dr. Eccles example, that it brings the urgent cases, the suspicious cases to the top of the list. So they look at that first. So this not only saves up to a 30% reduction in mammography reading time, but it also helps the doctor focus on cases that are in fact much more urgent. And then our second solution is that we also have one that identifies marks and scores in the actual mammogram. And that is our CM Assist product, which is like a second pair of eyes for radiologists. And the radiologist turns it on, and the AI flags areas that may be cancer so that the doctor can focus on those marks first.
Now, an AI is only as good as the data on which it's trained. So how did you train this AI, and is the data representative data? By which I mean, is it just a kind of, a white population? Is it a younger population, older population, so on?
No, I'm glad you asked that. So, there is a saying in the artificial intelligence world that, data is the 21st century's oil. Well, it's useless if you can't get it out of the ground, refine it, and turn it into gasoline. And by that analogy, I mean that it's really garbage in, garbage out. If you don't have clean, structured data to train the machine learning algorithms, you're not going to be accurate. And so that's actually one of our core competitive advantages, is that we have a heterogeneous data set. So we have mammograms from all over the world, from US, Europe, Asia, Brazil. And so to train our algorithms on different ethnicities and different populations. So that's critical. For example, dense breast tissue, as we all know, it's much harder to detect breast cancer in dense tissue. So that is an area that we excel at, in that we not only can apply to just a certain population or data set. And then in addition to that, we do clean the data ourselves. So there are increasingly companies that want to sell data, or there's hospitals or organizations that look to sell their data. Well, that's just half the battle to have it. You have to clean it and structure it so the algorithms can be trained on accurate data sets. And so we have some of the top data scientists and minds in the world, which is why to date we are the best AI medical imaging technology in the world in detecting breast cancer, having gone head to head. For example, MD Anderson ran a study with us against one of the top players in the space, and that is where CureMetrix excels.
And just to remind the audience, actually, the denser breast tissue is in older women, which is where the greatest cancer risk is.
Absolutely. Thank you for bringing that up.
So you've got AI, you've got your system. So how difficult is it to persuade radiologists to work with and alongside AI? Because there's a kind of trust and confidence thing going on here, isn't there?
There certainly is. There certainly is. And yes, CureMetrix is a physician support tool that complements the expertise of the doctor in better detecting that cancer. And as radiologists and health centers start to use our software and understand the value that our AI brings in helping them do their work better, more efficiently, they trust CureMetrix software more and more, and that our technology partners with their healthcare systems. Again, we're not here to replace the radiologist. We're here to empower them to take better care of their patients with these new tools and technologies, and to, of course, do it more efficiently. And I should add that one thing we found, radiologists have some of the highest burnout rates amongst doctors because they spend so much time sitting in a dark room looking at images. And so for us to be able to improve their quality of life and work and the workflow, they love it. In fact, many of our investors are radiologists and imaging center owners, because they know we're not just a fancy website or PowerPoint or a marketing deck. We have an actual FDA cleared product that works now.
So mammogram's your first medical imaging success. What about other areas of medical imaging? Where else are you going? Heart, lung?
Great question. Great question. So yeah, we of course decided to focus on mammography first, which is by far the hardest in the medical imaging space. When you look at a lung, your lung and my lung are in the same space. Our rib cages are in the same space, and so it's easier to apply AI machine learning capabilities to a lung image. Whereas in breast tissue, even the left and right tissue on the same patient are not the same. So we decided to be best in the world to laser focus and tackle mammography first. And so we have our CM triage product that's FDA cleared. Our CM assist is getting that clearance imminently here. And then we have a CM angio product that has gotten a lot of attention from cardiologists. We found that in looking at the calcifications in the arteries initially, the scientists weren't looking at that because they were just focused on detecting cancer. But we, in fact, found that we can give a calc score and detect early onsets of heart disease in a patient 10 years earlier. And one thing a lot of people aren't aware of, that heart attack is the silent killer amongst women. Us men know that heart attack is an issue, and we go to our cardiologist much earlier. But women, unfortunately, because they're not aware of that, sometimes it's too late. And so CM angio, as we get that into market, it's almost like a 2-for-1. The patient goes in for a mammogram, and they can get a calc score as well to detect that early onset of heart disease potentially.
So let me ask you, I mean, you've kind of answered it, but clearly there's a huge market here, but have you many competitors?
There's always competitors, and in fact, if there aren't competitors and we're doing something wrong, we're in the wrong space, and there's not a need, right? So, you have your traditional companies, the GE, Siemens, Philips, Hologics of the world, of course, that also have CAD software, but it's frankly not their business model. They make money off selling their machines and then service contracts to service those machines. And then we have other private companies that are also applying some form of AI, or as they say, to different images. Some are more lung focused or other body parts. We went for the hardest first, and we fully plan on rolling out our expertise to other modalities to detect not just other cancers, but other medical imaging needs, like CM angio, or in the neonatal space, for example, with pregnant women and the many ultrasounds they get while they're pregnant.
And have you got a partnership strategy, or is this something that you are developing yourselves alone?
The core technology is in-house, and that's our expertise and that's our competitive advantage. So it's not just about money. We had the head mammographer for a public company, one of the ones I mentioned, in fact, tell us that it's amazing how our technology was developed by this small team with much less money than bigger players and better finance, larger companies. So it's not about the money necessarily. It's not about the data set. It's about the team. So with that, what we look to do is find partners that are going to help get us into market faster. So we look at radiology companies that the radiologists use to review mammograms. They partner with us. We look at AI platforms that aggregate all types of AI for radiology. So we've partnered with some of the largest, like Nuance, Ombra, and Iconopedia. And so there are also outdated, computer-assisted detection companies that compete with us, but that don't have true AI. So we could partner with them as well.
Now, looking at or thinking about what investors are looking for, what are the key milestones for you over the next, say, 6 to 12 months?
So for us, we are looking to obviously scale and get this technology to market as fast as possible. our North Star is, just like cancer doesn't know borders and boundaries, we want to get this in the hand of as many radiologists at a global level. So, of course, the better financed we are, the faster we can do that, so that those sales and marketing efforts can bear fruit. Of course, we want to develop our technology in other modalities as well. And there's intellectual property protection. That's a big part of our, obviously, our business and our value. And so that's going to be our focus, is in raising the appropriate amount to deliver as fast as possible in various markets.
Now, you talked about that one of the great assets that you have is the data on which your AI is trained, being very diverse. But as you expand globally, and you've said that the markets are there globally, will you need to do further work to make sure that the populations are truly representative of the countries that you go into?
The short answer is yes. We're never going to stop improving the technology, shining the apple, so to speak, right? As I think it was the Reid Hoffman, the founder of LinkedIn, that says, software is always in beta. And so we're always going to be improving our algorithms. We're always going to be looking for additional data sets and mammograms from a diverse, heterogeneous population, especially as we do roll out to various parts of the world. There is a diminishing rate of return at some point, right? If you're at 99.5% accuracy, how much, if you got 4 million mammograms tomorrow, how much will that improve it? Of course, more is always better than less, but you do get to a certain point where at that level of accuracy, which we're at, it's not as urgent to feed it more mammograms.
Finally, I just want to touch on the regulatory side, because AI has been a bit of an unknown quantity, and there's been a lot of hype about AI. But I know that the US AI has been fast-tracked. So just tell me a little more about that and how confident you are of the regulatory process surrounding use of AI in medical imaging.
Yeah, no, I'm glad you brought that up. And the FDA here in the US, for a government institution, is actually doing an exceptional job, in my opinion, in looking at these new technologies. There's that saying that the law is always behind in technology, not just AI, just generally the law needs to catch up, whether it's privacy rights and GDPR, as we know in Europe, to laws around AI and what's ethical and what's not. For us, we have our FDA clearance on our CM triage, as I mentioned, the first of its kind to get that clearance. And we are looking at our CE marks in Europe for not just triage, but for CM Assist and CM Angio and the other products that we will be developing. The FDA is, I think, fast tracking a lot of this because, again, even though we're considered a diagnostic and need that clearance, it's not like we need to. We're not giving drugs to administer to patients. That takes much longer to review. So it is more accelerated, so to speak.
Navid Alipour, it's been such a delight talking to you. It's such an exciting field, and you're right at the forefront of it. Thank you so much for talking to us.
Thank you so much, Vivienne. A pleasure.